There have been quite a lot of measures taken in the last year or so. One which is very important is the fact that there is now a psychologist based in Ocean Views. I think that's an excellent addition to the service. There have also been two child psychologists added to the team that was already there, but now we have a kind of child and adolescent mental health team which didn't exist before. There has also been the inclusion of the creation of a post for the mental health matron, so that's just some of the things that have improved.
Now, you do say, however, that there are some areas where things can still be improved, such as, for example, the provision of social workers specifically for the area of mental health.
Well, this is one of the points that was brought up when we had our public meeting on the 18th of February. I think it was a general consensus that there wasn't enough help to support people in the community, and that was one of the points that was raised. The other points that were raised, for example, were the fact that people didn't like the idea, service users and relatives of service users didn't like the idea of having to go through the normal A&E process when somebody was having a crisis, a mental health crisis. They thought it was inappropriate, that it took far too long, that it's exacerbated an already very difficult situation. So that point has been brought to us time and time again.
So you'd like to see more supports in the community for people with mental health problems. But tell us what you mean by this.
There is some support in the community, but I think that there are quite a number of people who are living on their own in the community who perhaps don't have the kind of family support that they need, or maybe it doesn't exist, or maybe it's not possible for whatever reason. Something that was felt, that is felt strongly, that is the fact that there should be sheltered accommodation. I mean, at the moment there are two flats in the community, one for two males and one for two females, that help people who have been in Ocean Views for a period of time, in some cases for a long time, to be rehabilitated into the society. But we're talking about a place for long stay, people who cannot live on their own and who at the moment are living on their own but in not very good conditions at all. We feel that facility is something that we have as an objective. It needs to be created.